Hey, what is up, everybody? I am glad to be back from vacation, kind of. And this week I'm going to be doing a video on HIV and PrEP use, interviewing Mike Turk, for many of you who know him. It was recorded a few weeks ago. Didn't get exactly enough time to edit it, but here goes nothing.
Everybody, my name is Mike, as you probably know, Mike Turk, Dr. Turk if you're nasty. I am a PharmD, I'm a pharmacist, and I'm also an AAHIVP, which is a little certification that means I'm an American Academy of HIV medicated. Oh, Jesus Christ. Let me start over. Hi everybody, my name is Mike. I am a pharmacist, and I'm here to talk to you today about PrEP. I have a PharmD, so it's Dr. Turk if you're nasty. And I also have an AAHIVP, which means I am certified by the American Academy of HIV Medicine as a practicing specialized HIV pharmacist. So I kind of hopefully know what I'm talking about. So,
probably more than what I know about. I have been, a little background on why I started and chose to do this topic for everybody and interview Mike. I actually started Truvada myself, and that's really bright over here and backwards, but I actually started this last week. I've been on it for 8 days now, and I had a lot of reservations in the past about taking it. About a decade ago, I was assaulted, and when I was at the hospital afterward, they gave me the post-exposure prophylactic, and that was awful on my system. It wrecked me, and so that's why I was so hesitant about taking PrEP, was because it's some of the same medication. But from what I had a long conversation with my doctor about, was that it's a different amount that I'm taking, so it doesn't make me as sick. Because I just remember being I had to take 10 pills a day for 3 weeks or something, and I got really sick, so I was really hesitant to do it. So I started asking Mike about different questions about PrEP. I started asking my doctor. I spoke to my pharmacist here in town about what would be the best medication for me to take for it, and apparently Truvada is the only PrEP medication. Is that correct? Okay. So once I got started on it, I asked Mike about 8 million questions, and it turns out that a lot of people, not only in the den, but in the world, because PrEP is not for gay men only, it's pretty much for anybody that does not want to contract HIV or wants to help reduce their risk. And as somebody who's a sexual health educator, I thought that it was a really good opportunity for me to ask questions that other people can also hear the answers to, so we can hopefully start to stamp out some of the stigmas around taking PrEP, or if people want to learn so that they can tell other people who they think might have reservations about taking it. I had reservations, and I have a master's in public health, and I told you that before. I was super hesitant about taking PrEP, even though I was on it, and I felt super stupid for not knowing so much about the medication that I've been pushing people to take. So ultimately, what is PrEP? When people take this, I'm not going to call it a little blue pill, because that's the opposite of what it is, and it's not Viagra. It's a big blue pill. It's a what?
A big blue pill.
Yeah, it's not I can think of a few people who have choked on things that are bigger than this. So, yeah. Especially watching the video. It's not huge, but it's not the smallest thing in the world. I don't have.
If you can't swallow it whole, you can split it and take it in half. Just FYI.
I was going to ask you that, because I know that there are some medications that, because of the coating that's on the medication, that you can't split. For medications that have the time-released coating on it, how long does it? And in my head, I guess
there are about 4 different extended-release delivery systems, so I cannot give you a general answer.
Well, does extended release actually happen? I guess because I'm super skeptical, because I think as soon as it's in my stomach, that shit is getting torn up.
Nope.
Really? Because I always assume it.
If it's something that is acid labile and will be broken up by stomach acid, we coat it with something that is impervious to stomach acid, but will melt in the basic environment. So that when it leaves your stomach, it will melt in your intestines, but not in your stomach. So that the coating falls off in your intestines where it's absorbed. If we have some stuff like Ritalin, LA, or Adderall XR, Actually, the Adderall tablets, ignore me on that. Ritalin LA is a capsule, and it's got a bunch of beads in it. Some
Yep.
of the beads are instant release, and some of the beads are coded to be longer release. So you get an instant bump right away, and then it's over time. And then there's things like Concerta, which is super cool. The tablet itself has like an osmotic delivery system in it. So the instant release is sprayed on the outside of the tablet, and then after that, there is a slow osmotic push as it passes through your intestine that slowly pushes more drug out as it moves through your intestine.
Is there any part of your intestine that's more absorbative?
Depends on the drug.
Okay, so getting back on track. So I guess the first like real question that I could ask that would be the super most basic question is, what is PrEP? What makes Truvada Truvada?
Truvada is a combination of two drugs called NRTIs. That's nucleoside reverse transcriptase inhibitors. They inhibit one of the enzymes or chemicals that HIV uses to replicate itself. They're very specific for viral enzymes. They don't really touch the human enzymes at all. That's why the side effects are kind of minimal. I know that everyone's heard of the mitochondria as the powerhouse of the cell. It can affect
endostomach. You just shot me back to college.
Some of the older NRTIs did it worse. Newer ones like Truvada, which is entrectinib and tenofovir, do not do it nearly as badly. So we don't see the side effects with these we used to.
Okay. So with that, if somebody was going to go to the hospital, or if they were going to go to the doctor or their pharmacist or whomever to talk about getting on Truvada, what is the protocol that somebody could expect before starting it? Because I know for me, I had a meeting with my doctor. I had a bunch of blood work done 3 months ago, and then she actually did blood work just this last week when I had it done again. And after that 3-month period, she was more comfortable prescribing it to me after a negative test 3 months apart.
Which makes sense.
And I know that's not the case for everybody. There are some people who can get on it right away. My doctor was just more comfortable in me waiting 3 months. So I don't want to say, because there's no standard set of what to expect, but for your average person looking to start PrEP, what can they expect when they're going to be starting it?
There are suggestions from the CDC, and then there's what a lot of like infectious disease physicians do who I work with. The general goal is we need to make sure first you're HIV negative. You cannot be HIV positive. You cannot be a person living with HIV and start a Truvada alone. Because if you are HIV positive and you start a Truvada alone, you run the risk of developing resistance fairly quickly. So step one, HIV test. They can either do the rapid antigen or they can do the antibody antigen combination. The rapid antigen, we know within 2 weeks or so of exposure whether or not it's positive. So that only has like a 2-week window. The older one is a 4-week window, so we kind of have to do a repeat. That's likely why your doctor did the first one, and then a repeat at 3 months to make sure you're still negative. Okay. 2 in a row negative, you do not have HIV. We know that. Some physicians will actually ask, do you experience these symptoms of acute HIV infection? And if you say no and your test is negative, they'll start you there. They'll have baseline blood work. We need to make sure your kidneys are okay. We need to make sure that your basic metabolic panel, like your electrolytes and everything in your body, is okay. But that's really it. We just need to make sure that you're generally healthy, and we can start you on it usually fairly quickly.
So, I know I have to see my doctor once every 3 months to get blood work done. I know she mentioned that part of that was for my kidneys, to make sure that they're still functioning correctly, as well as I think they have to do a urine test. It's there was a word I kept saying over and over and over again because it was fun to say, and I can't remember what kind of test it was. You probably know. It's a urine test for something. I don't remember what's the word.
Proteinuria, which is you can shed protein in your urine. The biggest, most acute concern with Truvada is the kidney injury. Extremely uncommon.
From the medication or external?
From the medication.
Okay.
The one of the notorious side effects of Truvada, and I'm not trying to scare people out of taking it because it's extremely rare. And it's more common in people who are living with HIV because HIV is itself hard on the kidney. So they will do a baseline serum creatinine, which is how we assess your kidney function. And then they will do a serial or a follow-up every 3 months, usually for the first year. And then we'll space you out probably every 6 months or once a year if you've been stably on it for a while. We can talk to you about what a kidney injury looks like so you can know if it's happening between testing visits. But I can tell you in my experience, of all of my patients, I've only seen one patient with a kidney injury from Truvada, and that person was living with HIV. So they had other risk factors for one. You also, every 3 months, will need to repeat HIV tests. Because again, if you end up seroconverting or end up positive for HIV, we need to get you into treatment as opposed to PrEP. And I also recommend, and so does the CDC, that if we're seeing you, since you're there, we should probably check you for chlamydia, gonorrhea, and syphilis at the same time. Because why not? You're in the room.
Right. And that's from a public health perspective I've worked with the CDC on multiple occasions. Not a sidebar. If you are going in regularly for HIV tests, but you're not getting tested for syphilis, gonorrhea, chlamydia, you're not helping yourself very much. It's not fun to always go in, but like and I'm somebody, like, I'm sex positive. I go to my doctor, and if the reason I've seen her for as long as I have is there's no judgment, and I know that does not always happen in the medical field. But when I go in, I'm not ashamed to be like, how about let's do it. I think we've even like made a joke about it. I'm like, let's do a full panel sex test is what I'll say to my doctor. She's like, fair enough, and then we do whatever. And I've had one thing once in my life, and I took a pill for like 2 weeks, and it was done, and I never had to worry about it again. And I think that most people don't realize that syphilis has long-term effects on your body that can be real bad for your body.
For the record, syphilis can paralyze you, can make you drop you into coma, can affect your speech, your hearing, your language. It can slowly kill you. It can make you go blind, and you can be asymptomatic for a long time before all that happens.
So being gay could turn you blind.
Yes, so please get tested. Thank you.
Listen, people. Okay. So once people get started on PrEP, I know that we already discussed that people do the kidney test, they do kidneys and they check your blood work, and they do an HIV test. Should you test positive for HIV? There's two questions that popped up most often with people. One was, does that mean it didn't work? And two, are you going to be you won't just stay on Truvada, because that there's a different, I know you know that there's a whole different regimen and things that you take care of once you've tested positive, but did it not work? And what can they expect if they do test positive during one of those trips?
First off, I want to make sure we need to define work and not work. Truvada works really well as PrEP. It really does. It is not perfect. The clinical trial data in MSM, which is the CDC term for men who have sex with men, because let's be honest, we don't all identify as gay. Not every MSM is a gay man. Shows a risk reduction, depending on the study, between 86 and 96%. Post-marketing data actually looks better than that, but in the clinical trials, that was our number. We say, we can reduce your transmission rate by around 96%, the transmission risk by about 96%. So it is expected at some point that if you have enough sex, enough unprotected, enough less safe sex, you may still contract HIV while you're on PrEP. Your risk is greatly reduced. That is the point we're trying to say. So I wouldn't say that Truvada failed. The Truvada did not work, but we know it doesn't always work.
So it's just like a condom. If the condom doesn't work,
condom break.
Yeah. So there's an anticipated risk even though you're taking the medication, and
which is why I always recommend. And again, the PrEP doesn't protect you against other STIs, so I usually recommend that PrEP and a condom is the best way to do it. But I know that's not always realistic because some people just wear condoms.
And that is something that I want to reiterate, and you can say that again, because a lot of people think, like when women are on birth control, they can still contract STIs, they can still contract HIV. They can, like, it's not.
Too, just for the record, it's not perfect either. Just
right. Right. So, like, I think there's a huge idea, and I mean, it's part stigma, part assumption that if you're on PrEP, you can have as much unprotected sex as you want, and you're totally going to be fine from anything. And I think that, in my perspective, it does. And as a clinician, do you think that it has increased unsafe behavior? And I know that's a huge, huge stigma out there that because people are on PrEP, they're going to go have sex with everybody, which I don't care if they do, but do you think that it's actually increased risky behavior rather than try to assist in just reducing HIV infection?
Actually, there is an ongoing sort of trial trying to assess that, because obviously the perception is that, prior to PrEP being approved in 2012, which by the way, it's been 5 years, 6 years now, so we have a good data on this. Since prior to PrEP approval, one of the arguments was that it's going to encourage unsafe behavior. I will tell you in my practice, I don't really feel that it has, because a lot of the people who were on PrEP previously just weren't doing anything. They weren't using condoms then either. So as far as, because it hasn't changed that practice, it's basically just made them less likely to contract HIV from it. There's an ongoing study trying to determine perceptions and then rates in other STIs in patients who are on PrEP. Data is not published yet. I'm waiting for it to come out. It will be out at some point in the next 6 months or so. I'll be able to give you a good, solid, evidence-based answer. I don't like to guess. But in my personal experience, and I know anecdotes are not data, I haven't seen a huge uptick in other STIs.
Because I know how, and I wrote a very big post about it on Facebook when I started PrEP, because I thought that, and there are people who have reached out to me since then, hence the topic that we're discussing today. But there is this idea that suddenly you become you have risky behaviors, and that you're constantly sleeping around. Which, if you are anybody, no one's business. Go for it and get some. Like I don't care whatsoever. You might be on it because
I'm a virgin, so I don't know what you're talking about.
So am I. I've never ever touched a man in my life.
I've never done a
The only man I touch is Jesus, and as a Jew, that makes a lot of sense to me. So
absolutely,
yes. So this is also a medication, as I am aware, for people who are intravenous drug users.
Mm-hmm.
Now, is that something that changes how you're tested with your doctor? I know that when I was with my provider, she asked me very explicitly, in a non-judgmental way, but more for her information, that do I use intravenous drugs? And while, I don't, I know people that do. I know people that have used it in the past, and they're on Truvada simply because it's similar to like a needle exchange. Like, we would rather see, we can't completely curb an activity, but we can make that activity less of a risk to public health. So
needle exchanges are an interesting parallel here, because a lot of the arguments against needle exchanges is that they will encourage drug use. They don't.
So that same thing could be said about Truvada, where they're providing a means towards, I don't want to call it even safer sex, because that's not the right term I'm looking for. I think they're providing a means of risk reduction for contracting HIV no matter what your activity is, which is the exact same thing for heroin users or any injectable drugs. People are using clean needle exchanges because we know it's still going to occur. So if we can find a way to do it the most safe and effective means of eliminating the spread of a disease, like, we're absolutely going to do it. And I know that you know that clean needle exchanges are heavily scrutinized by a lot of people. I worked for one actually in Superior, Wisconsin when I was in college. We did a clean needle exchange in an HIV program. We would go to different like local gay bars, and we would do free testing at the bars at night, and we lost our funding because of Scott Walker. If anybody knows who that is, they lost their funding and they had to shut down in Superior, Wisconsin, because the funding wasn't there anymore, because it was such a we were encouraging people to do drugs and have unsafe sex. So, sidebar, anybody living in Wisconsin, please vote him out this fall. That would be wonderful. So, another question I had is side effects, and that is something that I asked you probably 14 times after I started the medication, that I'm not even kidding, I would text him an apology before I started asking him a question when I was asking all of these things. For those who feel like this is, some people have incorrectly stated it's like chemo. When like that, and that's something that people think, like, you're fighting off a disease that you're not fighting anything off. That's not what it's for. But people are under the assumption that you're going to get sick when you start this. You're going to feel nauseous and gross. And I know that, and how we discussed it, I felt like I had symptoms that the next morning when I woke up, I realized it was just me telling myself that I had those symptoms. What can people expect when they start it?
It's fun because, like, if I say, "Hey, do you itch?" Now you itch,
Right.
because it suggests that you itch and say, "I'm going to experience an itch." So a lot of the symptoms that people feel from it are not really proven to be from the drug. They're from anxiety surrounding taking the drug. A lot of people have this like image of HIV and AIDS treatment as, Philadelphia, or and the band played on back in the olden days. And like I say, olden days, I'm old myself. I remember the 80s very well. I remember when the AIDS epidemic was on its way out. I know what it's like growing up gay in the 80s and 90s during the age of AIDS, and I remember seeing what people who were in HIV treatment looked like. It was horrible. AZT was a chemo drug that was removed from the market because it was so toxic. The cancer was less damaging to the patients. We put it back on the market because it was one of the few things that could save someone who was dying from HIV. However, we don't really use AZT anymore because we have better things like tenofovir and emtricitabine, and which are two of the ones that are in Truvada. There are two others that are commonly used. I'm not ready to talk about them because they're not used for PrEP. The biggest side effect that you're going to experience from Truvada is going to be the first couple weeks. You might have some stomach upset, and it's better if you take it with food. It can help it go away. And I tell my patients, take it at night, sneak through the worst of it, and within a week or two, you won't even notice you're taking it anymore. Other than that, things like headache. Some people report like a runny nose, stuffy nose, but again, I can't really link that to the drug.
Because there's nothing in the drug that would cause somebody to have a runny nose.
No.
Okay.
But I mean, you and I talked about this. You almost expect to feel something, so you kind of do. But as a rule, it's extremely well tolerated. I have seen in my practice maybe 2 people who who've had to come off of Truvada because side effects that they couldn't deal with. Not like kidney injury or bone density changes, which are 2 actual side effects of Truvada, but like GI upset, nausea, things like that they just could not handle. 2 people out of all of them. It's extremely well tolerated. It's a fairly benign drug. There are a couple of legitimate, like, I don't want to say legitimate because I'm not trying to delegitimize other people's experiences. I'm saying there are a couple of serious side effects that are worth discussing, and that is, like I said, the kidney injury, which is rare, but the best way to tell that is if all of a sudden you are peeing a lot less. You're still drinking regularly, but you're not peeing as much as you used to, or your urine is very, very thick, or any other, very concentrated in some way. Get checked out if that happens. You may also have some flank pain, so some like pain down in the side if that happens. The other one is, and it's nearly inevitable, you're going to lose some bone when you're on Truvada. Everyone who takes tenofovir loses some bone. We have 14 years of experience with Truvada. It's been on the market since 2004. We know that it happens. We also know that it does not increase the risk of bone fractures in any way. So you're not going to.
So you do lose some, but it's at a level that like.
Clinically insignificant is the phrase that we use.
Okay, yeah, because like I'm in rugby and I don't want to get hit and I lose 17 ribs. And do we even have 17 ribs?
People with pre-existing osteoporosis may need more frequent bone scans, but people who do not have pre-existing osteoporosis, it's not really a concern. So those are the big 2. Other than that, not much.
I mean, I take it at night with dinner, and the first day, like I said, I had symptoms because I was convinced I should have symptoms. But I don't even I take it with my other medications, and that's another thing. If you're on other medications, do you have to worry about taking it with is there anything that you shouldn't take, whether it be legal or illegal, to take with it that could change the effectiveness of Truvada?
Truvada interacts with very few things. Off the top of my head, I mean, no, it's not something I worry about with nearly anything. Because, I mean, there's a theoretical interaction with one liver enzyme, but it's not really that big a deal. And it is not one that we would suggest reducing the dose for, and it doesn't cause anything clinically significant. Because, again, Truvada, the drug levels are high enough to take care of the virus, and you can actually drive them higher and you wouldn't experience toxicities because it's just not very toxic. One of the components you essentially can't overdose on. It is completely benign. Emtricitabine, I mean, you could drink it like water. It wouldn't hurt you. And then tenofovir, beyond the risk of kidney injury is also benign, so it's something to worry about. So other drugs, not a big deal. Other drugs that are damaging to the kidney, maybe be a little careful with. So don't like be mainline and ibuprofen all day. We shouldn't be doing that anyway because it's not safe. Ibuprofen is actually itself much more dangerous than Truvada, but people don't realize that because it's over the counter. So is Tylenol, just for the records. So yeah, I don't worry about drug interactions much with Truvada at all.
Now, if somebody forgets to take their med, I haven't missed a day of my medications in years because I have my watch reminds me to take it every single day, and then it'll keep bugging me if I don't do it. But
if you miss the one of yours, you're going to be miserable. So
right, yeah. Some of the ones that I'm on, if I don't take some of those, I'm going to have a real rough day the next day.
Mm-hmm.
So I missed tomorrow's dose. If I take it the next day, is it like birth control where I miss a day and I could potentially not get pregnant, but like it increases my risk of contraction?
Truvada has a pretty long half-life, which means it hangs around your body for a decent amount of time. There's a good thing to that and a bad thing to that. The good thing is a missed dose here and there, not clinically relevant. Doesn't matter. The bad thing is you have to take it for a week at first. You have to take it for 7 days straight before it's effective.
Or 7 days gay.
7 days gay. 7 days consecutively. 7 days daily. 7 days daily forward. You have to take it before it becomes effective. So if you start on Sunday, no unprotected sex until the following Sunday, because you will not reach effective drug levels in your system because of the half-life. There's a long pharmacokinetic explanation for that. I will spare you. But on the other hand, since it has a long half-life, it hangs around for a while. The data shows that if you miss no more than 2 or 3 doses a week, you're still likely protected. So this is actually fairly tolerant to missed doses. Most drugs are not that tolerant to missed doses. So try to take it every day. If you miss 1 or 2, not the end of the world. If you miss 3 days in a row, when you remember to start taking it again, 2 tablets. Take 2 tablets together. That day, like on day 4. If you miss days 1, 2, and 3, on day 4 you take 2 tablets together to give yourself a load, and then resume your once daily after that. And again,
so just the 2 for that one day.
2 that one day,
okay,
and then 1 day after for 4 or 5 days, and then you get the drug levels back up in your system.
Okay.
Or more.
So after, say, 30 years down the road, when I finally meet my husband, I decide to stop taking this because I don't need to take it anymore. Is there any side effect to just stopping it? Like a lot of medications you can't just stop taking. You're either weaned off or one thing or another. Is this something that somebody one day could just go, I don't feel like I have, not that anybody should self-diagnose their risk necessarily, but that is also one's decision to do so. If I decide one day that I'm going to be a nun, priest.
I'm a big believer in shared decision making. So yes, you have the absolute right to stop any drug you want. You're the patient, not me. So yeah.
But like, is it going to impact them in any negative way?
There is one specific patient population for whom that is true. Everyone else can just stop without thought. You could stop it tomorrow, would never even know you took it, taken it. Within a week, it'd be all completely out of your system, like it was never there. Their only exception is people who have hepatitis B that has been treated and is in remission. So a person with hepatitis B in remission, the ingredients in Truvada, tenofovir and emtricitabine, are both active against hepatitis B. So if you have hepatitis B, we can actually use Truvada to treat you. It's one of the first-line options. And if we do that and get it in remission, when we stop the Truvada, you might flare. If you have a treated hepatitis B that's in remission, because hepatitis B never goes away, just for the record. It's not like Hep C and Hep A. Hep C we can cure, Hep A goes away on its own. Hepatitis B stays with you forever. So on MSM, get your vaccinations against hepatitis B if you don't have it already. Anyway, so the patient who has been treated is in remission, it starts on Truvada. The Truvada then continues to suppress the virus. Your body's like, oh, thank God, someone else is doing this. I don't have to deal with it anymore. And then when you stop the Truvada, you may have a flare of hepatitis B. So if you do have hepatitis B and you start on Truvada, you need to have a long discussion with your physician or other provider prior to stopping it. because they may need to check your viral levels of hepatitis B after you stop Truvada to make sure you are not popping positive for the virus anymore.
Perfect.
Other than that, no, just stop it.
We're not telling you to stop. We're just saying if you want to stop, you can
When it's
stop.
time to stop it, you don't have to taper off. Put it that way.
And then one of the last questions that I had was one that I asked you just for my own knowledge. If I'm on Truvada and I have sex with an individual and I'm exposed to someone who has HIV, and I know that there is a lot of discussion about can you be asymptomatic carriers exist obviously, but can you can you transmit it to someone? If I have sex with one person who has HIV, then the next day I have sex with somebody who does not have HIV. Do I pose any risk to that person for contracting it, the second person, in that, I'll call it, sequence of people? What risk do they have? Because in my head, I'm like, I'm on Truvada, I'm good to go, I'm not going to contract it. Do I pose a risk to that person?
You do not. We'll call them, we have the person with HIV, we have you, then we have the person who does not have HIV who you then have sexual encounter with. If the person with HIV is undetectable, which means they have a viral load less than 20, because that's as low as we can detect, we're to have sex with that third party. That third party would be in no danger of contracting HIV because undetectable is untransmittable. We've known it for years. The CDC finally released their statement. Thanks, guys.
Thank you for just now doing that, CDC.
Thanks, we knew. Thanks for supporting us. I can talk about that study at some point too. It's super awesome. Anyway, so the person who is living with HIV may have 19 viral copies per mil of blood. They can then have sex with that third party. They're not going to transmit HIV to that person. You also may have received that less than that whatever viral load they gave you, even if they aren't undetectable, even if they are viremic, they're not going to inoculate you with that many copies of the virus because we simply just don't. And that gets diluted down in your system, and you're going to go ahead and have sex with that third party. You will, even if the HIV were actively replicating in your body, which it will not be because the Truvada stops that, you would not have enough HIV in your system that soon to transmit it. HIV takes time to set up infection. It takes a couple of weeks of what we call acute HIV infection. That's the fever, sore throat, like the worst sore throat.
The flu is what I've heard it been called on multiple occasions.
Symptoms of the acute viral illness, because they're all fairly similar. Viral illnesses are hard to differentiate by symptoms. But during the first 2 weeks of active infection with HIV, you feel like hell. That is the time at which you're most transmissible. That 2 days, 1 day, 2 days after that encounter, there's no concern. Not a concern at all.
So even if the person could transmit it, if they weren't undetectable and you had sex with this person, it would be a few days before you have enough viral load in your system that you could pose a risk to somebody.
You basically need time to build the virus up in order to transmit it to somebody else. Many viruses are like that. HIV is not alone in that.
Cool. All of the other questions were kind of answered. The last one, let me see. Okay, so the number one barrier to people taking PrEP is the money. So I was floored when I know it's expensive. A lot of medications are expensive without insurance. I mean, I carry a very expensive bag in a Ziploc. And this at retail value on the bag I brought it home with was $1,900 for 30 pills. First off, I know that not everybody has access to health insurance. Not everybody is in a financial situation. I find myself very lucky to be in the financial situation that I'm in, that I know not everyone has access to. But I didn't pay $1. I didn't pay anything to get this. The most expensive thing was my copay for my doctor's appointment. Than actually this. I know that Gilead, is that how you say it? Gilead? They have a program where they have copay assistance. They have discount coupons, and I'm on the copay assistance. So basically, my insurance covered like $1,850 of the medication, and then Gilead took the last $50 off with that program. Are there resources out there for people who may not have insurance or who are too low of an income or work a job that they don't qualify for insurance or whatever their situation may be? Are there options for people to get on Truvada or something? I don't want to say similar because, as you said before, there is only one Truvada. Are there options for people to start Truvada that won't put them into bankruptcy so that they can prevent contracting?
Yes. They're not always easy, not always places you want to go, but they're there. A lot of what I recommend for people like you who are well insured and who have a stable income, good household, you can go to your regular physician, you can get it taken care of, they can do it because you are health literate, you're able to navigate the system, you're paid, you're fine. But also, I put it on civilized countries like the UK, it's like $6 for everybody because they have, a healthcare system that works.
You're a communist. Calm down.
Actually, I'm more of a socialist because I'm like left of Sweden. However, I'm going to leave that somewhere else. Anyway, like we guarantee basic income and all, y'all. She's a commie. Anyway, so for patients who have more challenges with funding, for patients who are underfunded or do not have the resources or insurance or things to navigate that, as you said, Gilead does have a patient assistance program. It's hard to navigate on your own if you're not used to doing things like this. The best thing I can recommend is that you find a clinic, an infectious disease clinic or a clinic that specializes in care of patients with HIV, because they do this all the time.
Yep, and I know Ryan White, is that still a thing?
Ryan White is the national program that is essentially a form of Medicare for patients who are HIV positive. It is not for people who do not have HIV.
So if you want to get on PrEP, Ryan White's not going to cover PrEP for somebody.
You qualify for Ryan White because you do not live with HIV. But several states have health departments that provide PrEP for free. Florida will be starting that relatively soon, which is a huge win because we lead the nation in diagnoses, y'all. So we are starting a really good program there, and I'm happy to see that. My recommendation for most people, you go to a clinic that specializes in HIV. If you cannot find a clinic that specializes in HIV, go to the health department because they are usually your safety net catch-all for places that do not have clinics that specialize in HIV. And they are used to working with people to get their PrEP at low or no cost. I know a bunch of Florida resources, but not real relevant for y'all because this is a national program.
Yep.
But the best thing I can do is recommend that you Google an HIV clinic in your area because they are used to doing this. They know what they're doing.
Last, fine, but not least, that I will punch this out. If I test positive for HIV, is my life over? Will no one talk to me again? And what do I do next?
If you test positive for HIV, we will take the Truvada. We will leave you on Truvada, most likely, and we will add a third agent, usually something called an integrase inhibitor. We will actually, we'll not give it to you with the Truvada. We'll give you a single tablet that contains all three meds together and just make your life easy. HIV these days is managed more easily than diabetes, more easily than hypertension, more easily than a lot of things we manage every day. You take your medicine every day, and you will live a long and normal life until you die of what everyone else dies of: heart attacks, cancer, strokes.
I was going to say, everything else that kills Americans. You'll die like everyone else.
Random gunfire, anything at all. But if you are in treatment for your HIV, you will not die from the HIV as long as you are in treatment and you take the medicine as you are supposed to. HIV is now a chronic condition. We don't see people dying. We don't see people with that Angels in America horrible spiral down anymore as long as they stay in treatment. The struggle, honestly, is to get them to stay in treatment. And one of my roles in my profession is to get them to stay in treatment. But as long as you do, you will live a long and normal life.
So really, the hardest thing to make, if you were to test positive and you contract HIV, the biggest struggle, assuming the financial aside, the biggest physical struggle is lifting and opening your mouth and putting a pill in your mouth. That's the biggest thing that people have to worry about, realistically.
Yes. Realistically. And HIV clinics, most HIV pharmacies will actually deliver the meds right to your home, so you have no excuse whatsoever. So.
Yeah, and that was something when I got the prescription, I had to fill out a form. Like, I've never filled out a form before picking up a medication. It asked a lot of questions about
copay card, your assistance program.
Yep. So and they, even when I was there, they said if you need us to send this to you, we'll mail it to you. And the very first pharmacist that I saw, I will leave location out for. I shouldn't, but they're just terrible people. The very first pharmacy I went to when I went to, I mean, like I said, I'm a sex positive person. I'm not somebody ashamed of my sex life, nor am I ashamed that I'm gay or any other aspect, or the fact that I decided to take Truvada so that I can reduce, or I can at least play my part in reducing the risk of contraction. They were very judgmental at the first one. I got the look at the prescription pad, the look at me, the look at the prescription pad, the look at me like 6 times, and I called her out on the spot about doing it. Not something everybody is comfortable to do, but I was livid because I'm legitimately doing something to improve my life and to help other people, and this lady did not care, and I took my business elsewhere for the medication. But you have, I mean, granted, you are in the field, so you have and you work very exclusively with infectious disease, specifically HIV treatment. So you're not one that's going to be judgmental of people. But if you do experience any sort of discrimination from a doctor, a pharmacist, or whatever you may have it, or struggle filling it, this is a barrier that I've heard people do, that they're too scared to go get it filled because the looks you get on your face. Do pharmacists have a legal obligation to fill your medication?
Essentially, yes.
Okay, because I know that I've heard people say that they had such a hard time filling their medication because of whatever the circumstances may be, and they felt like they were being turned away because they were going to be taking this medication. Is that something that can be reported somehow? And if you are mistreated for being on PrEP or HIV positive and you're on your medications, is there a way to report that kind of thing?
Some states have ridiculous religious objection laws. They usually apply to birth control. I've never seen anyone try it on HIV treatment or PrEP. However, if you are in a situation where the pharmacist refuses to fill it and there is no good reason, the best thing to do is to ask why. And if they give you an answer that is not medically sound, you can report them to the Board of Health or Department of Health or whatever your state equivalent is. Because we do have some shared decision making as pharmacists with physicians. There are things that I refuse to fill because they're unsafe for the patient, but that is not what we're talking about here. I know it's nerve-wracking. I know it's scary. I know that you already feel exposed because your pharmacist now knows that you engage in higher sexual behavior, and that might weird you out a little bit. But it's not acceptable for them to refuse to fill it because of a moral objection. So first thing is you can report them to the Board of Health, Department of Health, whatever the hell y'all have, wherever you happen to be. Second thing is to find another pharmacy. If they are unwilling to take care of you because you are trying to make sure that you do not contract HIV, then would you want them taking care of you for anything else? The answer, in my opinion, is no. My place is not to judge my patients. My place is to make sure that my patients live the healthiest life that they can with appropriate medications and with appropriate lifestyle modifications. And the idea that a pharmacist would refuse to fill someone's PrEP sets me on fire. I don't get angry about it a lot, but it angers me when I see that.
I'm not one to berate people in public. I am known to call shit out when I see it, but that really irritated me when she was actually willing to visually judge me for trying to fill this medication, and I was not having it that day. I was already having a real shit day, but when she came and she did that, I called them out on the spot, and I left, and I brought my...
I occasionally hear asides, not in my current health system, but in previous experiences, I hear asides from other healthcare practitioners that say things about people who are living with HIV, or say things about people with psych conditions, and I immediately shut it down and I correct them because I don't live with HIV, but I certainly might someday, and there's nothing wrong with people who do, and Lord knows I live with psych issues. So I make sure that I make it clear, and I shut it down because I don't permit stigma in my environment of any disease. I don't make fun of someone for their diabetes. I'm sure I'm not going to make fun of them for their psych issues. Really is that simple.
Cool. So to wrap this up, if anybody has any questions, Mike will have the YouTube channel or the video URL, whatever you want to call it, on YouTube, he will be able to see comments on there and would be more than willing to answer questions on there. If you have any, if you have more of a private question, you can always shoot me a message and I can get the information to Mike, so that I can get you an answer and you don't have to rely on WebMD to answer
Please
your...
don't.
The other week, like I said, I put symptoms in and I either had chapped lips or like cancer. They were like, you either have chapped lips or you're about to die. And so
Parkinson's once, so yeah, don't ask WebMD.
like I'm not a fan of that website, but I have anxiety. I don't need to make it worse by assuming that I have everything wrong with me already. So but yeah, thank you for your information. There are resources that I will be putting at the end of this video in the credits for people to access different sorts of information from the CDC, any departments of health, people who have HIV. I'll be putting Ryan White program information in there. And I will get some links on any pertinent information from Mike, as you have sent me a million different links to things so that I can read, because it's not out of boredom. I'm genuinely wanting to know if I'm dying whenever I take a pill, because he's like my personal pharmacist in my phone constantly, all the time. And trust me, I have plenty of questions in my life. So I'm a God-fearing virgin. So if my rabbi's watching, I'm sorry. So thank you again for stopping on. I appreciate the information. I will see everybody next week. Is there anything you wanted to say to wrap it up? Or wrap it up? I'm fucking funny.
I know you're on PrEP. Wrap it up anyway. Number two, thank you for everyone asking questions, because I am more than happy to answer any questions you might have. This is my personal professional passion, and I am here as a resource for all of you. So, thanks.
Perfect. Thank you. All right, so there you have it. I hope you enjoyed our interview. I am really apologetic about the audio quality being basically like a potato. There were some issues that I had with dubbing over the audio, and I wanted to get the video out there. But if you have any questions, do feel free to leave a message in the comments. Message Mike, message me, message whatever you have to do, message the den if you have any questions. We're not here to judge you whatsoever. So I hope all of you have a fantastically phenomenal week. Thank you for watching. Again, it's good to be back. Can't wait to get back in the swing of things after being in Hawaii for a week and a half, and I will see you next Tuesday on the den. Bye.